Well, more than a year after her predecessor announced it, Julia Gillard's finally secured a national deal on health and hospitals. At least $100 billion will be pumped into the system over 2 decades, and the Prime Minister's promising improvements in waiting times and outcomes. She's made key changes to Kevin Rudd's plan, but all the states and territories have now signed up. Political correspondent Greg Jennett reports from Canberra.
Bedside in the 8th month of the year of delivery.
And so you're off for surgery?
Tomorrow.
Tomorrow?
Yes, they've been promising me that for about weeks now, but it might eventually happen.
The Prime Minister has a national health funding deal.
More money, more beds, more services, more local control, greater accountability, less waste and less waiting times around the nation.
It's a deal, but it's not the deal her predecessor thought he'd secured 16 months ago.
Ladies and gentlemen, is a very, very big reform of the health and hospital system of Australia.
Julia Gillard's is not quite as big, but it is in the bag.
Well, this is signed, this is done, and it's agreed to by all states and territories.
Core elements of Kevin Rudd's ambitious agenda have disappeared at the stroke of a pen. A guarantee to perform all elective surgeries within clinically recommended times has shrunk to a target instead. A guarantee to see 95% of emergency department patients within 4 hours has become 90%, and a goal for the Commonwealth to meet 60% of future growth in hospital funding has shrunk to 50%.
When I go to hospitals, people don't talk to me about financing transactions. They sit in emergency departments and say, when do you reckon someone's going to come and see me?
The package still promises a big injection of federal funds for public hospitals beyond 2014. There's $16 billion in the first 5 years alone.
There's been a lot of changes since the first offer we had from the previous Prime Minister. At the end of the day, we know we need more funding, we know we need more beds.
Prime Minister insists the deal will hold the states to account and will be transparent. Because of that, she says it'll end the blame game. The differences with Kevin Rudd's proposal are stark. More than anything, though, it contains a large dose of political pragmatism, far removed from the health funding purity he once favoured. Greg Jennett, ABC News.